The world is in the midst of a vaping crisis.
I call vapes a harm introduction device.
Some are laced with weed, THC, ketamine, mushroom, the whole container, God knows how many tons of liquid cocaine, which are going to be made into vape.
As supply chains transform, addiction rates are spiraling out of control.
Ito yung amoy na ito para lang siyang candy.
When young people can't get their vapes, the cortisol levels in their brain spike, which triggers stress, anxiety, and other mental health issues.
Tinggal kawan saya mengatakan saya ini dah gila.
We are risking our children, our future generations.
Manila, Philippines. Officers from the Philippines Drug Enforcement Agency bust a drug syndicate. Boxes containing cannabis oil and marijuana-laced vapes are recovered. It's a country fighting a prolonged drug war that has led to the deaths of over 12,000 Filipinos. And drug-laced vapes are the new battleground.
When vape products are laced with dangerous drugs, the Philippine Drug Enforcement Agency comes in. We conduct test-buy operations. Who sold the marijuana vape bring the item to our laboratory for testing. Once it turns out to be positive, we then set a bypass operation.
Vape products containing marijuana oil and synthetic cannabinoids are a violation of the Comprehensive Dangerous Drugs Act of 2002.
There's social media being used by these illegal drug peddlers. You also have their messaging apps to sell these marijuana vape products. We have our intelligence service. They monitor online sellers. This is very dangerous for school children because any chemicals would definitely have a reaction with their bodies, with their brains.
Since 2022, the Philippines Drug Agency has confiscated more than $960 million worth of drugs being infiltrated into the country. These include more than 3 million electronic vapes and accessories.
Thailand legalized the use of marijuana in their country for recreational purposes. Several unscrupulous individuals sent marijuana vape into the country. We intensified our interdiction units. So with the airports, seaports, and land travel to avoid the smuggling of marijuana vapes into the country.
Despite strict monitoring, vape supplies flood into the country through porous border routes. To understand the rise in cannabis vape use, we travel to Tarlac City to investigate. After careful negotiations, we secure access to a cannabis-laced vape seller on the condition his identity is concealed.
Ang pangalan ko is Zap, alias Zap, 24 years old. Nag-start ako mag-vape noon dahil nag-yossi ako actually kasi. Sa akin actually, mga barkada ko lang din. Yung katuwaan, trip-trip lang. Kaya, ayun, na-try namin itong marijuana vape. Itong cannabis oil, ito yung parang artificial sa push. Ito yung amoy na ito para lang siyang candy. At tansya ko dito is siguro makaka-1,000 puff ka. Mga ibang tao ngayon dito sa Pilipinas, hindi pa nila alam tong ganitong drugs na ganito na nakalagay sa vape. Ito yung pinaka-popular ngayon, Turn. May different color din siya, white. Ito naman is Indica. Tsaka pangalawang pinaka-popular ngayon is Montana. Then meron na rin namang mga 2 grams na cannabis oil. Ito, medyo pricey din to. Nasa around 3.5 to 3.8 ang market nito sa marketplace.
Drug sellers like Zap run their entire operations on the internet.
Sinesendan niya ako tuwing may kuha sila galing sa custom. Ayun, sisend niya sa akin yung mga brands tsaka kung ilang gram yung isang cannabis oil. Then yun, mamimili ako. Siguro mamimili lang ako mga 10 pieces. O kaya tig-isa kada brand. Sa akin kasi yung source ko, ang kuha ko sa kanya nito is 2.5. Pang Manila rate na siya.
Once the supply is in, Zap coordinates the physical drop-off points with end users through encrypted apps to deliver his product.
Nakakabili yung mga friends ko sa akin through minsan Telegram. Yan. Ito, nag-ano kasi to dito dahil yun nga, sabi ko nga sa dead drop. Hindi na siya kaliwaan. Kumbaga, pipicturean ko na lang sa isang lugar kung saan ko tatapon yung item. Then, sisend ko yung location ng Google Map exactly. Then, doon na lang nila pipick upin.
Initially marketed as tobacco alternatives, vape devices then evolved into electronic nicotine delivery systems, or ENDS, which are now being infused with new psychoactive substances that have penetrated global markets. Drugs laced with cannabis have attracted new and younger users in the Philippines. In the city of Montalban, Elaine began using nicotine vapes, believing them to be a safer alternative to smoking.
Nag-vape ako dahil nag-quit ako sa cigarette smoking. The most common reason bakit ako na-attract sa vape is yung amoy, then yung flavoring. Nag-upgrade yung vape. Kapag meron akong cards, so everyday ko siya ginagamit. So after work, pagka-uwi ng bahay, so ginagamit ko siya. Hindi ko pa siya na-disclose sa family member ko. Nalilesen din yung risk ng safety mo kasi nga hindi nga siya legal sa country natin. So medyo natatago kung paano siya nagagamit at the same time. Hindi siya takaw tingin sa mata ng tao. So like lang rin siya, like cannabis lang rin. So yung weed, the most common effect is yung namumula yung mata. So syempre kapag na-hit or nakuha mo na yung limit ng usok na puff mo mula sa card, so may tendency na machoka or masamid ka. Kasi siya 100% na THC siya. One puff lang talaga is mararamdaman mo talaga na i-effect talaga siya sa'yo. Kapag nag-take ka ng cards or vape, so one hit or one puff only, so mag-e-effect siya sa loob ng 1 minute. So mararamdaman mo yung effect na medyo bumabagal ka na, though nare-relax yung muscle mo. Kung wala akong gagawing activity or nakaupo lang ako sa bahay, nanonood lang, siguro maglala siya mga 10 hours to 12 hours. Pero kung hindi mo siya afford, wag. Dahil, yun nga, mahal siya bilhin, then hindi mo rin siya agad mabibili, no? Kung wala kang connection.
One survey estimates that 70% of Filipino youth believe e-cigarettes and vapes are less harmful than traditional cigarettes. The health impact of vape addiction can be seen at the new CNA MDI hospital in Santa Rosa, Laguna.
I called vaping products, vaping devices, a chemical cocktail. Why cocktail? Heated flavoring mixed with nicotine, heated with metal, with propylene glycol and vegetable glycerin, just to mimic the cloud, the smoke of tobacco, is really dangerous. Our lungs are not meant to inhale flavors. So that's why we have these cases. It can create metaplasia, a disturbed cell growth in the lungs. And that is actually a harbinger of cancer.
The Philippines recorded its first vape-related death in May 2024, quashing claims that regular vapes were safer than smoking.
This is a 22-year-old basketball player. He was actively doing the basketball. He is having coffee a week. But he is a known vape user for 2 years. Varied disposable, varied nicotine, varied flavors. Suddenly, he dropped because there is this chest pain. He's having a heart attack aside from the respiratory failure. But due to that pneumonia, consolidated pneumonia, a good student dying.
Growing health and addiction concerns have forced the Philippines government to legislate the Vaporized Nicotine and Non-Nicotine Products Regulation Act. The law aims to curb the sale, use and marketing of e-cigarettes and heated tobacco products to those aged below 18.
I call vapes a harm introduction device. You can just inject, put a syringe, and then put all of those illegal substances. Vapers and smokers are victims of the industry because they have the nicotine trap, you have the flavor trap, then you become dependent. As a pediatrician, I want these products banned because the children's brain, body is developing.
As drug-laced vapes threaten future generations in the Philippines, rehabilitating those fallen in its trap in Malaysia is becoming urgent. Malaysia is in the midst of a drug crisis. Its visible impact can be seen at Rumah Sahabat Drug Rehabilitation Centre, where the country's youth is desperately seeking hope of a new beginning. Rumah Sahabat means the House of Companions in Arabic. It is home to 27-year-old Ahmed Hazik, who is undergoing addiction rehabilitation. 8 years ago, he was offered an electronic vape by his schoolmate. That moment changed Ahmed's life forever.
Saya ingat benda tu selamat lah daripada rokok sebab orang kata nikotin dia lebih rendah daripada rokok dan asapnya tak seteruk rokok lah. Orang saya kata vape ni serupa vape ganja lah. Saya pun rasa ingin cuba, so saya try benda tu. Saya terjebak lah dalam vape mushroom ni. Jenis dadah yang saya ambil melalui vape ialah mushroom THC dengan CBD oil. Saya menagih vape mushroom ni daripada umur 19 ke 20. Sampai tahun lepas lah, 2024. Susah nak berhenti vape mushroom ni. Sebab saya still duduk dekat dengan kawan-kawan yang sama apa semua. Keinginan saya untuk mencuba tu sangat tinggi bila saya duduk dengan diorang. Assalamualaikum, nama saya Ahmad Hazik. Sehingga kawan saya mengatakan saya ni dah gila apa semua, dan saya rasa ingin nak mengamuk lah time tu. Saya start marah-marah kawan, saya start marah-marah mak, nak menerapkan intibati.
Amid's condition worsened in hospital, where he fought through treatment for 2 weeks. He experienced severe mental delirium and dangerous behavioural changes.
Start daripada tu, saya ni diberikan perhatian oleh mak. Mak saya cuba call psikiatrik untuk ambil saya daripada rumah, bawa saya ke psychiatric ward untuk pemulihan saya lah. Sehingga kan saya punya penyakit ni berulang hingga 4 kali lah saya masuk ke psychiatric ward. Even saya dah masuk psychiatric ward pun saya tetap ambil juga, sebab susah nak berhenti dalam vape mushroom ni, sebab saya still duduk dekat dengan circle yang sama. Saya start mengamuk sehingga kan saya dibawa ke psychiatric ward lah, dan saya rasa sangat malu lah, sebab time tu jiran-jiran saya semua tahulah saya mengamuk time tu. So saya rasa bersyukur lah, kerana Tuhan bagi saya peluang lagi untuk kekal pulih lagi, untuk kekal hidup macam orang normal lagi. Sebab saya tengok ada yang memang dah memang, bukan nak saya cakap gila, tapi memang dah tak boleh nak berinteraksi dengan orang lagi.
Follow Syabir's instruction,
Amid now undergoes a structured rehabilitation program. It features farming, designed to help him reflect and plant the seeds for a new way of life.
Okay, hari ni saya minta kat you all semua buat aktiviti kebun simple je. Okay, sekarang ni saya minta awak fokuskan pada sekitar alam semesta ni. Okay, awak nikmati seluruh alam semesta ni, apa yang awak tengok. Oksigen dan karbon dioksida.
Since then, Amid has recovered from schizophrenia and bipolar disorder.
Bila kita hisap benda tu, kita ambil substance ni, kita dah tak fikir dah kita punya family, kita punya generation, kita punya masyarakat kat luar tu, dengan orang macam mana. Saya dah jatuh ni beberapa kali, dan benda tu pun ada, setiap kali saya jatuh, keinginan saya nak bangun tu memang tinggi. Memang dadah ni membinasakan diri lah. Tak berhenti, kita akan pergi ke 3 tempat ni lah. Institusi, penjara dan maut. Pada penjual-jual vape, dadah ni semua, terutama mushroom lah, tolong berhentilah, sebab awak menjual tu, awak telah merosakkan awak punya own generation for your country lah. Matlamat masa depan saya kan, saya nak hapuskan dadah kat negara ni lah. Kalau boleh saya nak banggakan nama ibu bapa saya, agama, bangsa dan negara saya lah.
Drug addiction in Malaysia is on the rise, partly due to an increase in synthetic drugs being covertly distributed through vapes. Rumah Sahabat has hit full capacity, with 150 residents living here.
Nak kaitkan dengan zaman penagihan aku, manalah ada berpeluh pagi-pagi macam ni. Betul tak?
45-year-old Mohammed Shamshir is lead coordinator of the facility and knows this crisis all too well.
Started off as a resident here myself 9 years ago, when I came in with heroin, meth addiction, ketamine, ecstasy, alcohol, and whatnot. Almost everything. So I've been here for 9 years now, helping others coming out of this addiction. Various kind of vapes. They said some are laced with weed, THC, some are with ketamine, some is mushroom, they call it. The police had a bus in Penang. The whole container, God knows how many tons of liquid cocaine, which are going to be made into vape. I've been with drugs since I was 12 years old. Hundreds of times, in and out of drugs, in and out of drugs. Every time I fail, when I try to stop myself, every time I will fail. I couldn't do it alone. But here with friends, it's possible. To stop drugs, we need to learn to. We need to learn to know ourselves, our triggers, our weaknesses, our strengths. We need to learn how to forgive ourselves and forgive others.
Across Malaysia, there is a growing public pressure to ban vapes nationwide. Malaysia recorded more than 192,000 drug users and addicts in 2024, a 32.5% increase from the 145,000 cases the year before. 61% of these individuals are aged between 15 and 39.
It's a spiritual journey. Kita cari diri kita yang sebenar dalam erti kata agama. Modul rawatan yang kita gunakan pakai is bio, psychosocial, psychoeducation and spiritual. So we start our day as early as 4:15 in the morning. The boys will go back to their dorms and they will do the house chore for in the dorms. They will get ready for the singing of the national anthem, Rumah Sahabat song, anthem. And then we'll have a bit of march past, exercise, and so on. And then we will have our breakfast. We've got, out of our 150 residents here, about 80 of them are diagnosed with mental illness, kecelaruan mental, and it's all caused by drugs. So we've got medical appointments almost every day. Biasanya kita ada buat kelas early recovery, kelas relapse prevention, 12 langkah narcotic anonymous, sharing group static dan sebagainya lah. And also waktu riadah. That means everyone have to choose a sport to play. Antara main bola, main takraw, main badminton, bola tampar, atau main gym saja.
In 2023, the Malaysian government amended the Poisons Act 1952 to allow the sale of nicotine-laced products. The move aimed to curb the rampant sale of unregulated vape products in the country. Despite this measure, almost 20,000 cases of students vaping in schools have been recorded in 2024.
Penagihan ni adalah satu penyakit kronik yang berulang. Bezanya kini, the boys yang buat rawatan di pusat-pusat sebegini kan, mereka dah mula ada education, ilmu untuk mengatasi masalah penagihan ni. Tapi yes, based on our statistic, kadar peratusan yang berjaya because we've got an alumni group. Kita ada satu group alumni yang members of the group dah sampai beratus orang. It's more than 200 dah. We've got clients who've gone out to join the army, to join the police, to join ADK, to become a professor even. Great businessman. Ujian ada banyak kat luar. Kita pun tak boleh sentiasa jaga mereka bila mereka dah tamat rawatan. Tapi kita sentiasa kat sini, pintu kita selalu sentiasa terbuka. Kita tak ada pintu pun sebenarnya, pagar pun tak ada. And so they can always come back. I mean, yeah, look at the guys, they are having fun here. Ini bukan satu tempat yang mana diorang traumatized and all. Bukan macam dulu lagi dah.
While Malaysia moves towards a gradual ban on vapes, Indonesia struggles to find a way out. Indonesia leads the world in e-cigarette and vapes consumption. As of 2021, the number of users in Indonesia was estimated to be 6 million. The country's limited tobacco control regulations have translated into a refusal to ban vapes and e-cigarettes as well. It's made the country a desirable target for vapes laced with drugs, which are now infiltrating. June 30, 2025, the North Sumatra Regional Police's Drug Investigation Unit raided a liquid vape-producing factory in Medan, Indonesia, The drugs recovered were identified as Class 1 narcotics worth $18 million. Investigations revealed the vape factory could produce a total of 57,000 drug-laced cartridges. Eric van der Veen is the head of UNODC Indonesia and Malaysia, who is keeping a close eye on vapes laced with drugs.
First of all, that demonstrates that law enforcement in Indonesia have the right kind of intelligence and that they're acting on it. Vapes don't necessarily come with the labels of what is inside them. We have seen reports of derivatives of marijuana, cannabinoids, like THC or CBD that are used through vapes. Methamphetamine, ketamine, etomidate or nitazines that can have very destructive health effects on the users. We have extremely dangerous substances that are fed into a product that is largely mainstream, that is widely available, that is promoted on social media, that you can buy online, and that looks very attractive to young people, to children who have no idea what they're purchasing and what the effects on their health can be. So those three things combined may potentially become a explosive combination when it comes to drug use and the negative health effects for individuals as well as for public at large.
More countries are heading towards harsher legislation against vaping products to fight drug abuse. Australia banned recreational vaping while limiting the sale of the devices to pharmacies, only with a doctor's prescription. India banned all forms of electronic cigarettes and vapes in 2019. The Netherlands banned flavoured vape liquids in 2023, while France enacted a ban on disposable vapes in 2025. China banned domestic sale of flavoured vapes, excluding tobacco flavour, and required flavoured vape exports to comply with the destination country's regulations. Despite being banned from marketing and selling online, vape companies are bypassing Indonesian authorities with creative strategies. Muhammad Bigwanto's research investigated the new ways in which social media is used to target the youth.
The government regulation number 28/2024 saying that all e-cigarette and tobacco products advertisement and promotion in social media, it's banned. I don't think the social media platform like Instagram categorize them as ads, advertisements. It's a bit more like what we call it manipulative. All of the promotion they use is using the young influencers, and like around 64% of the content actually using woman image. They have 1 million followers, and then the way that this is more dangerous, it's because marketed as less harmful. But unfortunately, the Minister of Women Empowerment and Child Protection don't have kind of responsibility and rules to stop them. And then I think the government need to start to think about banning the product instead of regulating them.
An online study conducted by the University of Indonesia in 2020 surveyed over 1,239 respondents aged 15 and above in 5 major cities. The survey found high rates of e-cigarette use of 29% amongst study participants. More than 84% reported seeing e-cigarette adverts or promotions on Facebook, Instagram, and YouTube. The survey concluded that participants exposed to adverts and promotions were 2.9 times more likely to use vapes and e-cigarettes. Such aggressive marketing is impacting parents across Indonesia. Nia Umar is a health champion and chairperson of the Indonesian Breastfeeding Mothers Association, AIMI. Despite advocating for a healthier Indonesia, Nia's own children fell victim to the scourge of vaping.
My daughter She goes to school in Yogyakarta, Universitas Gadjah Mada. So she lives there, not in Jakarta. I think about the third months while she's there, we are having a video call, and then she was sitting in her room, like in her bed, talking to me, and then out of reflect, she just inhaled her vape. I think she forgot that she's talking to me. I was very upset. She's very disappointed of herself, and luckily she's quite reflective on that, and then she quit.
Aggressive outdoor marketing and peer pressure is getting more and more children to pick up vapes across Indonesia.
I think it's a huge gap in the regulations and what's in the reality. The marketing, I think it's very, very aggressive with the TikTok and social media. And they're using influencers, like very trendy influencers, very pretty girls, very cool boys. Like even in the podcast, the very high profile influencer doing the podcast while vaping. We are risking our children, our future generations with this vape. I think communication is the key. I think it's really important for you to be close and can talk to your children openly about this.
It's a global issue. In the United Kingdom, 20% of 11 to 17-year-olds in the country have tried vaping, an estimated 1.1 million children. New research by the University of Bath revealed more vapes are being laced with drugs. Up to 1/4 of vapes confiscated in secondary schools in England contained the dangerous synthetic drug spice. It has prompted a desperate search for solutions. Simon and Jean are parents of 4 young children. They understand the scale and seriousness of the UK's vaping epidemic.
Spice is a synthetic cannabinoid, legal in many parts of the world for a very long time and still sits within a grey area of the law. It behaves a lot like marijuana, but the effects are considerably stronger. It's particularly dangerous because it's difficult to trace, leaves no smell, and can be mixed into vapes quite easily. It comes from countries primarily like India and China as a powder and is smuggled into other countries. When it reaches its endpoint, it's melted down and mixed with e-cigarette and e-liquids to go into vape pens. As parents of 4 ourselves, we were very concerned. Vaping companies use methods such as brightly coloured packaging, advertising on billboards, childish flavours, interesting designs to lure children in. It means that their young brains can become easily addicted. Regular vape use in young people is reported to cause respiratory problems. When young people can't get their vapes, the cortisol levels in their brain spike, which triggers stress, anxiety, and other mental health issues. In extreme reported cases, it can produce heart attacks, strokes, and even death.
After years of research, Simon and Jean invented Vape Guardian, a unique sensor with advanced air monitoring to quickly spot vaping, drug use, and smoking.
So we thought we'd make something affordable for schools that was effective. Vape Guardian sensors differ from smoke alarms because smoke alarms send out a beam of light which, when it is broken, sets off an alert. Vape Guardian looks for 10 changes in air quality, which is backed by PhD research formulas for what vaping is and drug use is in the air. When those parameters are met, alerts are sent to members of staff and the vaping incidents can be dealt with.
These sensors have now been installed across hundreds of schools in the UK and 14 more countries internationally. While technology enhances surveillance, Thailand fights back by engaging its children. Vihandeng, Buriram Province. Police Colonel Boonchai Kongchurun and his drug enforcement team are heading towards an investigation site.
เป็นที่ที่เขาทิ้งร้างมานานนะครับเจ้าของก็ทิ้งร้างมานานแล้วก็มาเคลียร์ลิ่งแล้วก็มีการมาติดป้ายให้เช่านะครับก็คิดว่าพวกกลุ่มนี้ครับเขาก็เห็นโอกาสว่าที่ตรงนี้มันใกล้ๆกับถนนนะครับมีการเข้าออกสีส้มนี่แหละตอนที่เจอของกลางก็จะอยู่ตรงนี้พี่ครับแจ้งตลอที่วอสีเข้าของกลางของประชาชนอำเภอแจ้งให้ทราบสักครู่เดี๋ยวบริหาร2ป้องกันจะไปวอสีร่วมเตียงโอเค
Over 500,000 illegal e-cigarettes and vaping instruments worth an estimated $2.7 million are confiscated in the raid.
ประมาณแกะ800ครับ800กล่องก็ประมาณสักถ้าตีเป็นน้ำหนักก็น่าจะประมาณสัก20กว่าตันกลุ่มนี้จะเป็นพอร์ตเปล่าก็คือที่เตรียมจะใส่น้ำยาคือตรงนู้นนะครับตรงหัวตรงนู้นเอามาใส่ซึ่งพอร์ตเปล่าเนี่ยตัวเนี้ยที่บอกว่ามันสามารถเอาไปประยุกต์ทำเป็นพอร์ตเคได้ใช้ดูดเคตามีนแทนบุหรี่น้ำยาบุหรี่ไฟฟ้าก็จะเอาเคตามีนมาใส่
Back at the police station, Officer Boonchai is educating his force about the ever-changing packaging used by vape smugglers.
ตัวนี้นะครับที่กำลังแพร่ระบาดตอนนี้มากก็คือพอร์ตเคก็คือเนี่ยครับเคตามีนนะครับเนี่ยซึ่งลักษณะเหมือนบุหรี่ไฟฟ้าเพียงแต่ว่าตัวน้ำยาที่อยู่ข้างในก็คือเคตามีนเนี่ยนะครับมันจะเป็นตัวน้ำยาตัวนี้นะครับที่เอาไปใส่ในตัวพอร์ตอีกครั้งหนึ่งนะครับอย่างนี้เป็นรสสตรอเบอรี่แต่อันเนี้ยที่ล่าสุดก็คือเอสโคบาร์ที่เราเจอก็คือเนี่ยแต่การแพ็คของเอสโคบาร์มันจะเป็นแพ็คเป็นหลอดยาวแล้วฉีกออกมาก็จะเป็นสีเหลืองที่เราดูนี่เป็นสีเหลืองทั้งกล่องเลยทุกกล่องนะครับก็จะมียี่ห้อเอสโคบาร์ซึ่งเป็นตัวใหม่ล่าสุด
Sellers and smugglers now face harsher penalties in Thailand. It can result in a maximum jail sentence of 3 years and a fine of up to $18,000. Smugglers can also face 10 years in prison and fines reaching 5 times the value of the goods. Officer Boonchai is part of Thailand's nationwide drug abuse resistance education campaign. He routinely conducts awareness sessions with Buriram school children.
สวัสดีครับวันนี้คุณลุงนะครับมาให้ความรู้เพิ่มเติมบุหรี่ไฟฟ้าแล้วถ้าใครผลิตหรือนำเข้ามาขายในประเทศไทยจำคุกไม่เกินหรือปรับไม่เกิน500,000เลยและสูบบุหรี่ไฟฟ้าหรือบุหรี่ธรรมดาที่สาธารณะปรับเท่าไหร่
Under a new Thai law, the government now offers cash rewards to citizens for reporting e-cigarette and vape use.
ยาเคอยู่ในนี้ประเภท2นี่นะครับเคตามีนเอามาใส่ในบุหรี่ไฟฟ้าแทนน้ำยาบุหรี่ไฟฟ้าเพื่อสูบออกควันเห็นไหมมีการประยุกต์และจากการตรวจเนี่ยบางอันนะครับในตัวน้ำยาเนี่ยมีการใส่นี่เมทแอมเฟตามีนเข้าไปในน้ำยาบุหรี่ไฟฟ้าด้วยเมทแอมเฟตามีนเป็นยาเสพติดให้โทษประเภท1ประเภทร้ายแรงเห็นไหมนี่เข้าตัวเนี้ยมาใส่เพื่อให้คนติดจะบอกคนอื่นยังไงให้เขาเลิกสูบบุหรี่ไฟฟ้า
ให้เลิกสูบเพราะว่าอาจจะมีปอดพังและสามารถเข้าโรงพยาบาลได้เป็นอันตรายต่อคนรอบข้างคนที่เรารักด้วยค่ะ
โอ้เยี่ยมมากปรบมือให้เพื่อนหน่อย
Such programs sprang into action after Thailand's Department of Health Service Support conducted a survey that led to shocking results. It unearthed that 19 to 25-year-olds make up the largest group of vape users, representing 37.62% of the total. That age group was followed by 16 to 18-year-olds vape users, who stood at 29.26%, and the 13 to 15-year-olds vape users at 22.39%. Social media platforms and their influence contributed significantly to this trend, with Facebook leading e-cigarette and vape advertisements at 27.88% and TikTok closely trailing at 27.6%. To curb online vape sales to children, Thai authorities blocked more than 9,500 websites linked to the online sale of e-cigarettes and vapes. Despite such programs, the burden on healthcare remains heavy. The Satuk Hospital in Buriram is home to the Stop Vaping Clinic. Today, a 17-year-old patient is following up with medical consultant Ratsami Srisila about her vaping injuries.
สวัสดีค่ะเชิญนั่งค่ะ
The teen female user had been vaping for 2 years.
วันนี้อาการเป็นยังไงบ้างคะ
วันนี้หนูนอนหลับสนิทค่ะดีขึ้นไม่กระสับกระส่ายค่ะ
ค่ะ
เมื่อก่อนหนูตอนที่หนูใช้บุหรี่ไฟฟ้านะคะหนูทำอะไรหนูเหนื่อยหอมง่ายมากค่ะช่วงนี้หนูพยายามออกไปเล่นกีฬาไปเล่นตะกร้อไปกับน้องอะค่ะชวนกันออกไปหาอะไรทำไม่อยู่เฉยๆมันต้องแบบ
ดื่มน้ำอุ่นเพื่อที่จะให้ขับเสมหะออกมานะคะเพื่อให้ไม่คั่งค้างจะทำให้ปอดเราดีขึ้นไม่ติดเชื้อนะคะก็จะดีขึ้นเรื่อยๆนะคะ
The Buriram Hospital treated the first official case of a student suffering from lung damage due to vapes. Their efforts led to a government ban across the country on e-cigarettes.
ยาพวกนี้นะครับไม่ว่าจะเป็นเคตามีนหรือว่ากัญชาที่มี THC สูงๆเนี่ยนะฮะพวกนี้เนี่ยมันจะมีผลต่อการเข้าไปสู่ในเรื่องของระบบประสาทของซึ่งตัวนี้ผลมันจะค่อนข้างเร็วนะครับได้ทำให้เด็กเนี่ยมีอาการไม่ว่าจะมีหน้ามืดใจสั่นนะครับมีอาการสับสนคลื่นไส้นะครับหรืออาจจะมีอาการอ่อนเพลียนะครับเหนื่อยนะครับจนถึงหมดสติได้
Buriram's fight against vapes has spurred on other Thai provinces into action. Chiang Mai, Thailand. At the Sansai High School, the local police have gathered students from 34 secondary schools across the province. This awareness initiative is part of Thailand's campaign of No Drugs, No Dealers. Police Major Jetsada leads today's training.
แต่เดี๋ยวนี้มันมีการผสมสารเสพติดชนิดอื่นเข้าไปด้วยอย่างเช่นเคตามีนเมท
เด็กเปรียบเสมือนผ้าขาวเขาไม่รู้เขาอยากทดลองเขาอยากใช้เขาอยากตามเพื่อนอยากนำเทรนด์อยากทันสมัยถ้าเราป้อนความรู้ทักษะเทคนิคต่างๆให้เขาสามารถที่จะนำตัวนี้ไปพิจารณาและก็ประกอบการตัดสินใจในการเข้าใช้ยาเสพติดได้ครับเขาสามารถที่จะนำความรู้เหล่านี้มาเป็นเกราะกำบังเป็นวัคซีนให้กับตัวเขาในการป้องกันรู้จักวิธีในการปฏิเสธการใช้ยาเสพติดบุหรี่ไฟฟ้า
Students like 14-year-old Napalda Chaichuran have benefited from such programs.
ขายกันบ้างค่ะแบบเมื่อก่อนจะเห็นแบบคนเขาสูบเขาขายเยอะมากเลยค่ะแบบเดินไปทางไหนก็มีแต่คนสูบแล้วแบบบางคนหนูก็มีความรู้สึกมันดูเท่มากเลยนะคะแต่ว่าเพื่อนก็เหมือนกันค่ะเพื่อนก็แบบมาชักชวนว่าแบบเฮ้ยลองไหมอะไรอย่างเงี้ยค่ะแบบมันก็ดูเท่ดีค่ะแต่ว่าแบบที่พี่วิทยากรเปิดรูปมาว่าปอดเราจะเป็นยังไงหนูนี่แบบนึกภาพไม่ออกเลยว่าแบบหนูจะไปถ้าหนูตัดสินใจลองในวันนั้นหนูจะเป็นยังไงหนูแบบมันน่ากลัวจริงๆค่ะมันมากกว่าที่เราคิดอีกเราอาจจะไปซื้อมา 200-300 อะไรเงี้ยค่ะแต่ผลกระทบของเราอาจจะมากกว่า 200-300 ไม่ใช่แค่เรื่องเงินแต่จะเป็นเรื่องสุขภาพยิ่งเด็กๆอะค่ะเราขึ้นชื่อได้เลยว่าเราเป็นแบบอนาคตของชาติถ้าเราจะเป็นอนาคตของชาติที่ดีเราก็ต้องทำในสิ่งที่ดีให้ชาติด้วยปลอดภัยจากยาเสพติดอย่างยั่ง
Thailand's Ministry of Public Health has reclassified etomidate as a Category 2 controlled substance under Thailand's Narcotics Code. The updated designation responds to increasing concerns over the drug's illegal production and misuse, including its detection in e-cigarette and vape liquids. E-cigarettes and vapes, especially those laced with drugs, are devastating communities and economies across the globe. As supply chains become creative, countries require a collective and urgent response before future generations fall into its trap and cause irreparable damage for years to come.